Hi, it's Kelly and welcome back to room 9 3/4. Today we are going to be talking about our Lifepak. So in the department we stock the Lifepak 15s and they're stocked throughout the department as well as each resuscitation bay that we have. So first part about the Lifepak is your pads. So we keep these kind of in our side pocket here on our Lifepak, and you need one in the right anterior chest and one in the left lateral interior chest. And we do stock pediatric pads. You can put those in the same spots, or you can also put one on the front and one on the back of your pediatric patient, whatever works best for them. If your patient is to have a very hairy chest or something like that, you can always shave those areas. We do keep these in each resuscitation bay. So, big thing about the Lifepaks. So after you've got your pads on, you will need to plug them in. So we keep ours kind of twirled up right here. And it's arrow to arrow. So there'll be an arrow coming from your Lifepak, and then there'll be an arrow on the pads of your patient. So you'll just line those up and make sure there's secure connection. So after you have your pads on your patient, you'll want to turn on your Lifepak just by the on button here. Okay, and so this Lifepak is automatically popped up on the paddles rhythm. So sometimes you'll get a Lifepak and you will be on lead 2 automatically. That sometimes happens. So there's several ways you can change that. You can hit the lead button like I just did to change it to lead 2, or you can turn your speed dial here. Once you get the box around your heart rate, you'll click it, you'll click lead, and then you'll just scroll up to paddles, and then you'll be back on your paddles. So after you get your paddles on your patient, you've got the paddles showing up on your Lifepak, is kind of what we need to do next. So say your patient arrives in this rhythm. So this is ventricular fibrillation. And so Lifepak has a couple cool things about it in terms of VFib. So they do keep your VFib recommended doses here on the top of your Lifepak. And that is 200, 300, and 360. The other safety feature is it will not let you go above 360. So other cool features, these are all battery powered. We don't have to plug them in, anything like that. So your battery levels will be up here in the corner, as well as the joules that you're charged to currently if you were to hit your charge button. So right now we would be at 200 joules if we were to charge. So say we wanted to shock our patient at 360. So gray box for gray people is what I always say to help remember. So you'll turn your energy select up here. So once you hit energy select, you can keep hitting the up button, or you can turn your speed dial to turn it up. Again, won't let you go above 360. So now that you've decided you need to shock your patient, and you're at the correct joules that the provider has asked for, you'll hit charge. It will charge you up here. And then once you're all the way charged, you want to make sure that everyone is cleared from the patient and there's no one touching any part of the patient or the equipment attached to the patient. And then you will hit this shock button here and it will deliver a shock. After the shock is delivered, it will print you out a strip basically saying that they delivered the shock at 360 joules. So that is your standard defibrillation. Now, say your patient comes in say VTAC with the pulse, they're hemodynamically unstable, and your provider would like for you to synchronize cardio with this person in hopes of getting them out of this rhythm. So in that way, you will have, this is the most important button kind of on the machine for this, and that is the sync button. So you'll hit the sync button here, and as you see, they'll be kind of, they're a little tougher to see on this, but there'll be little triangles that pop up on your heart rhythm strip. And that is just syncing to the heart rhythm of your patient. And that is just a visual cue that the machine is syncing. And that is important because of the RT phenomenon, which we'll talk about kind of in some later videos. But it is super important that we shock on that R wave. So what you'll do for this is usually the providers will ask for 50, 100, or 150 joules. They could ask for more. That is just provider preference. So in this case, let's say we want to shock at 100 joules. So we will turn our joules down here to 100, and we will charge just like over here in our gray box. And then we will clear and we will shock the patient. So on this one, there may be a slight delay in the energy delivered, and that is because it is syncing. So it does need to sync on that patient's heart rate. So just because it won't immediately do it like you do the defibrillation. So just make sure that you're aware of that. Also, make sure you're aware that once you deliver that shock, there are no more triangles up here, and that is because every time you do synchronized cardioversion, you have to resync your machine. So if you were to need to shock this person again, you would have to come here, hit your sync button again, make sure your triangles pop up, and make sure that you're synced to the patient. So the next thing we'll go over, the other thing that this will do, it will kind of act as an AED if you need to. So it'll give you a CPR metronome. If you hit your CPR button, it'll analyze and tell you if a shock needs to be delivered. So that is just another kind of infrequent thing that we use, but is available on the Lifepak 15. The other thing that we can do is, so we can pace on this as well. So the thing about pacing on the Lifepak is, while this is a super smart machine, it is a little different in terms of pacing. So it can't both read the rhythm and give electrical impulses at the same time. So what you're going to have to do is when you go into pacer mode, you'll notice that your paddles rhythm goes away. And that is, again, because it cannot analyze and shock at the same time. So what you're going to do is you're going to take your 5 lead that's attached to your patient and plug it into your Lifepak right over here. And then you should see your heart rhythm reappear. So you've turned it on pacer mode. It's asking you for a rate. 60 is usually where we start. That's kind of provider order. And then once you get your rate, you will up your current until you get what we call capture. And so we'll start. So we will, and once you start upping your current, you'll see the pacer spikes appear on your heart rhythm strip. And what you want to do is have those capture. So 1 pacer spike, 1 QRS, 1 pacer spike, 1 QRS. And so you'll kind of keep going up with your current. Again, this is pretty painful to your patient, so you want to give some sort of analgesics or sedatives or something to kind of help your patient through this part. Okay, so it appears here at 70, we do have capture. Sometimes just to confirm and keep capture, we'll send it up to 80. And so once you get and receive capture on your patient, you want to check for peripheral pulses to make sure that it is actually capturing the heart rate of your patient. So once you have your pacer spikes that are captured and you have your peripheral pulses, your patient will be paced until they can go to cath lab or wherever they need to go after that. Like I said, pretty painful. So again, advocate for something to help your patient through this. And then other than that, that is really all there is to it, to the Lifepak. It will not let you turn the Lifepak off in pacer mode. So whenever you are finished pacing your patient, you'll just turn it off of pacer mode. And then you can turn your Lifepak off all the way. And like I said, we do keep these stocked throughout the department and then in each of our resuscitation bays. We keep all the equipment to restock them in our resuscitation bay as well. So other things that are of note, pediatric patients are usually 2 joules per kg when you're shocking them, 2 to 4 joules per kg. So just make sure that if you do have a pediatric patient on the paddles that you are aware of that. And then other than that, if you ever have any questions, let us know and then come back to see our internal defibrillation video next. Hi, it's Kelly. Welcome back to room 9 3/4 as we continue our education on the Lifepak. Today we'll be talking about internal defibrillation, which will happen in our emergency department when we do a ED thoracotomy or clamshell. So when we do internal defibrillation, you're going to grab your defibrillation pads. These come in adult and pediatric sizes, so just make sure you grab the right one off the shelf in room 9. This will be the responsibility of the doctor to set these up, but we are going to look at them today. So you'll click open the sides here, and when you open these up, you will have paddles and handles. So what you're going to want to do, or to have the doctor do and make sure, is that your paddles are secure in your handles. And how you are going to do that is you are going to insert them into the handles, push and twist down and pull to make sure they are secure. Again, these will be in a sterile wrapping, so this is a sterile procedure. So make sure that the providers were in sterile gloves and all that good stuff, but you are going to, again, push in, twist, make sure they are secure. So once your paddles are secure in your handles, you are going to go to your Lifepak. We keep the Lifepak 15s here, and they all should have internal defibrillator adapters. So what you're going to do is you're going to unplug your paddles that are on your patient, and you are going to plug in your internal adapter, just as so. And then on the other end of your handles on your internal paddle, you will plug into this adapter here, like this. Now, in this situation, usually your Lifepak's already on, but if not, make sure you turn it on. And then what we're going to do is a safety feature of the Lifepak 15 is it will not let you go over 50 joules if you have your internal adapter in. So right now, here in the upper corner, we are charged to 10 joules. So let's just go ahead and turn that up. See, you cannot go past 50. So what you'll want to do is once you get to that 50, as a nurse, you will be in charge of energy select and charging, and then your provider will have the handles and paddles in their hand. So what's going to happen is when you hit charge, the provider will actually deliver the shock using the handles. So you will have them say clear, and you'll have them deliver the shock with this button here. So we're charged to 50 joules. We will charge. Your provider will hit the button on the handle and deliver the shock to the patient. Afterwards, what you want to do when you're finished is you want to spray these with pre-cleanse and then send them back to sterile processing for cleaning. Can't wait to see you next time on Room 9 3/4.